Hey guys, we're here with another Alovéa Pros podcast. And boy, I'm excited for this one. This one is going to be a ton of fun because I am with Kori. Okay, I got to get this right. Pilkington.
Yes, you've got it.
Yes.
Yay!
I know we talked about that before, and I was like, I am just famous for messing up last names, but I feel like I got this name for the rest of my life now. I know it. I love it. Kori, I'm really excited for you to share with our listeners because you do
Mhm,
something that I think is one of those things that are so important to the world. It's one of the toughest things to do. It's such a commitment. You have to have such a huge heart. It probably is not properly appreciated across the board, and I'm sure from a compensation standpoint, because what you do is so critically valuable. But you've been a nurse, registered nurse,
mhm.
and I would love to hear like how long have you been in nursing? Like, tell us a little bit about your whole background, how you got into the nursing world.
Okay, well, I went to Brigham Young University, and actually, to be honest, originally I wanted to be a veterinarian, but actually, I changed my mind because one day when I was, in my classes, I think it was in um, it was in some kind of a science class. I can't remember exactly, but there was some noise going on in another room, and I kept looking there. And the professor's like, "Why are you looking over there?" I said, "I'm hearing noises," and he goes, "You're not going in there." And so, as soon as that class ended, oh, that's exactly where I went. And
Of
there were
course,
all
yeah.
these
If you're going to say don't go there, that's where you're going to go, right?
exactly. So anyway, I couldn't stand it. I had to go look, but it was scary because they had all these dogs. Their chests were cracked open and they were giving them drugs, and I'm like, "Oh, no. I don't wanna go to vet school if I have to do that." So,
I would
but
be
I
right with you. I would have been running out that door immediately, right then and there.
yeah, but then I realized, I mean, I love to take care of people. I love to help people with their health, especially I mean, I've just always been this way. It's just I think I was born with it, just a passion to help people. So, then I decided, "Okay, let's go into nursing." And it was the best thing for me because then I could actually focus on humans and their children. And that's just how I got started. I graduated from BYU 1975. So, yes, I am old, but that's okay because I'm healed from my problems.
That's a funny way to word it. That is a funny way to word that, but no, I like to say it. It's a beautifully experienced, and like both you and I are, and we have those experiences in life. But being a nurse and doing that for numerous years, I mean, just what are some of the most challenging parts about being a nurse, but also what are some of the most rewarding parts?
Well, I think some of the most challenging parts with nursing and with humans is when, I was working mental health at Logan Regional Hospital here in Utah and just seeing all of the things that people suffer with. It's very scary and it's real. So if you don't think mental illness is real, I'm here to tell you, I could tell you story after story. The mental illness is real. And, some of these medications had some pretty severe side effects, which I also saw and experienced. But, I don't know. It was just part of my nursing experience.
Hmm.
But I've done lots of different things and, I'm a person who likes challenges. So if I get bored with something, I mean, I got to do something different. So, what I really thought I wanted to do initially was do labor and delivery and do that NICU mama baby thing. And I love doing that. And I did that at three different hospitals. But after a while, it's like, I think I got to do something else.
It's another
So,
baby.
yeah, but I worked with wonderful physicians, just wonderful. And I was so glad that I had that experience. So, I've done lots of different things, moms and babes. The NICU, I did nursery for a while at Holy Cross. I've done the mental health thing. I've done just med surge, did that in the hospital, but I also did that with clinics. So my last 21 years, 23 years actually, is at UC Davis Medical Center.
Oh wow.
And yeah, and I did research because I thought, what the heck, I want to know what research is like. And so I did that for about 2.5 years. And that was with the SHEP study, the systolic hypertension and the elderly study. But we also did a diastolic study. It was called MIDAS. And then we went to supplements. I mean, research is really, really interesting. And, just the way that they randomize the people, in these clinical trials. So I did that for about 3 years. And then, I thought I got to do something different. And the SHEP study, the SHEP study, ended because finally they realized that systolic hypertension, or that top number of your blood pressure, people do die and have heart attacks and strokes at 160, that top number. And so, over time, the study people, and the patients, or we call them participants in this study, they started dying if they were on placebo. So it was a double blind study. So some patients actually, or participants, were on real med, atenolol, which is beta blocker, and then also hydrochlorothiazide, which is a water pill, or a sugar pill. Um, I've quite experienced with that, and I set up these appointments for those that had those kind of problems after they were out of the hospital, and then they had to come back and review all their symptoms, and you've read the hospitalization, everything, with the study doctors.
Wow.
So it was a fascinating thing, and I don't think too many people get bored like me. A lot of nurses just stay doing the same thing. They're comfortable with it. But
Yeah.
me,
You just were
no.
all, well, I mean, that kind of folds into the next question perfectly. But I mean, it is
Okay.
still fascinating to think that, you're constantly around a lot of people that are having a lot of challenges or health issues or
Hmm.
whatever
Yeah.
those may be. And so it's a lot on somebody, like you're saying, not only the clients or the patients you're dealing with mental health, but I mean, just the impact it could have on your own life. But you
Hmm.
said you're somebody who just, you want new ideas and new stuff. Well, then you decided to become sponsored by this company called Alovéa. So you're now official sponsored Alovéa Pro, and
Hmm.
sharing their research and their technologies and the impact. So how did that all happen? How do you get all these things going on and then you're like, I'm going to do this too?
Well, it just goes back to my story. So back in 2009, I had a very severe health issue, and I actually have a little. This is what this spot on my brain looked like. Okay,
My
it was in a
goodness.
yes, it was in an egg shape.
That's
It was
literally
a
what
little
I
bit.
thought you were pulling out. It looked like an Easter egg. I was like, where are we going with the Easter egg? That was in your head?
Yes, it was in my head. Yeah. So, I mean, it wasn't diagnosed right away. I had to go through like a weekend of insanity, and yeah, just weird things happening. I mean, I thought I was mentally health and challenged too. Just, some of the nervous or neurological deficits that I had, three of them right in a row, two while I was working and the other one while I was driving. So, and then I did have surgery to remove as much as they could out of that first spot. I call it my spot. And then, of course, just being on all the drugs to try to reduce the brain swelling, try to come back to life. One of my funniest stories actually is just, in that rehab phase, this, well, let's see, it's Dr. Davis. And this is at UC Davis Medical Center. She knew I was cheating, like on my therapies.
I was like, wait, what are you cheating on?
Well, she would call me out with my cheating because she asked me, "What do I want to accomplish?" And I said, "I just want to finish my Mimi, my little baby girl granddaughter, her moo. I'm a sewer and a quilter, and I just can't figure out the pockets. Like this is ridiculous. I mean, I've been sewing and quilting for absolutely decades. There's no reason why I can't do this." And she goes, "Yeah, there is. You had brain surgery. Yeah." And so I would cheat, and I would just like, I don't know, get around what a normal person who is recovering would be doing. And
Which,
so, but
oddly
she
enough,
says,
as a nurse, you were trying to keep your patients compliant. Now you're the patient and you're not
yeah,
behaving. I'm
yeah,
just
that's the
saying,
weird.
I'm
Yeah.
sure somebody's called you out on that.
Oh, yeah. 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 So, fast forward to 2021 approximately. This was during COVID. And so, this friend of my sister's, her name's Tracy Clark. She had talked to my sister Monday, and my sister Monday had told her about this word business in my head. And literally, after the surgery, 3 years goes by, and this spot has grown again to be about 1 centimeter,
Ooh,
right where the old one was. And
right.
so she's like, "Hey, your sister told me all about you. So do you want to get rid of that thing in your head, that spot in your head?" And I'm like, "Oh yeah, it's got to go. It's got to go." But I'm on this medication that keeps everything straight, and I have to take it because if I don't, I probably won't be able to drive. So that was like the big deal. But this medicine they gave me, I didn't like it. It didn't feel good. Just a lot of problems on these medicines that are harsh. And so, anyway, she's like, oh, let's just call up a friend of mine in Denmark. He's a doctor and see what he's got to say about it. And I didn't have any idea about Alovéa. I didn't know anything. So, I,
Which is always interesting, right? When you've been in the health field and you do
yeah,
research and you do all this, but now you've been exposed to something new that's oddly enough just is
right.
really food-based medicine too. So I
I
mean,
know.
yeah.
I, I was stunned, first of all. But God's always been on my side here. So, I just have faith in him, and wherever he leads me, that's where I go. So she set this call up and I was talking to him, and he actually knew all about my problem. I was so stunned. He knew that what he gave me a regimen of 8 of these capsules a day. I asked him what they were, and he goes, "Oh, it's acemannan, don't you know?" No, I don't know. I don't know. So, anyway, in research, if we didn't know something, what would we do? We would go to pubmed.gov. Okay, so these are research trials that are going on all over the world. In study settings like universities or even doctors' offices. I mean, they're doing research all the time on everything. And so, anyway, we would go to this website, and I thought once this doctor in Denmark told me, "Hey, this is what this is." I wrote it down with my trusty pen. And I went right to pubmed.gov and looked up acemannan, and lo and behold, oh my gosh, that was so inspiring. And
Wow.
so when he told me 8 a day, and then, keep that inflammation down with the beets, and then I felt like this was right. I felt like he was telling me the truth. I'm a groundswell person. I see the research, I hear someone who is very smart and able to break it down for me, and so I just started that.
So you're willing to dive in and try it out. And so how
Well,
did that impact you?
oh my gosh. So after 6 months, it was time for another MRI. So this MRI showed that it had reduced in size from 10 millimeters to 6 millimeters. And so I was very encouraged. And also, it said on the MRI that the active disease was no longer. How about that? So I just thought, okay, I'm going to keep on this. I am committed. And even to this day, I still take exactly what I took from the beginning, because I don't know why my immune system allowed this spot to grow. I just don't know. And I'm not going to guess. So, I'm just, wow.
Well, and it's pretty amazing because this company has a special program for coaches, trainers, athletes, and healthcare
Hmm.
professionals, which of course you're a
Hmm.
healthcare professional, where they sponsor and partner with coaches, trainers, healthcare, and professionals to be able to share the message around what this
Hmm.
company is all about in the product. So obviously the products have had such a massive impact to your life. So to be sponsored, it feels like that's a natural, right?
Oh,
Now
yeah,
you're sharing the products with clients and other patients and people but
absolutely.
you have a patient at home. You're telling me earlier that I mean a new product came out with Alovéa that's really transformed your own patient.
Yeah.
Tell us about that
Oh,
story.
yeah, that would be my husband. So both of us got sick in September of 2023 with this virus there is no cure for it. According to, our doctor. We see the same doctor here, he's in Layton, Utah. So anyway, this my poor husband just would be short of breath climbing the stairs inside the home, and he was fatigued. He just couldn't get out of bed till like 1, sometimes 12. But he was basically non-functional. And so I had to take over everything. I had to take over uh all the outside uh, lawn care, everything, raking. Now, I will not touch a snowblower. That is his job, but because it scares me. But anyway, he just was just non-functional. And so, I started, trying to figure out what to do for him. And it wasn't until this gut health thing, the core came along, that things started turning around. I mean, really turning around because, well, one of the first things I noticed is I went out to this market. It's a little Hispanic market in town. And when I came back, what was he doing? He had a rake and he was raking like a 24-foot long, all these leaves from our walnut tree, which is gigantic, which I've now snipped down because it can't be this way ever again. If, if you can't help me, because I loaded up like 12 bags of leaves last year. It was over the top, but he still didn't feel good. So now that, he's feeling like he wants to rake, and that was the first thing that I noticed, that all of a sudden he was just outside raking this huge long leaf pile. And I said, "What are
And
you doing?"
nothing else changed in his life. He's just now taking that new core technology for your gut health.
Yes,
You're just seeing like he's coming back to life, really, it sounds
it's
like.
it's exponential. I'm telling you. And the next thing was, it was on a Friday. We had a big snowstorm here in Clearfield, and there was probably, I don't know, maybe 8 inches of snow over 2 days. And I did the same thing. Well, this time I went to Walmart and came back, and I said, "What are you doing?" "I'm snow blowing." I'm like, I couldn't believe it. So, like, and then, other things with him is like getting up. So like last week, he got up, around 10 in the morning. So that's better than noon, right?
Right.
And
Yeah. Huge
so
difference.
last 3 days, now we've been on it for 10 weeks. So I take two, he takes two. So one in the morning, one in the evening. So anyway, I mean, the last 3 days, he's gotten up around 8. And yesterday, because see, it's now I'm really noticing. So yesterday he got up at 8 and I said, "You're up early." And he's like, "Yeah, I gotta get going. I gotta go to the store and I gotta do this and I gotta do that." He was gone until 2. And so when he came back, I'm like, wow, he was still upright.
It's amazing what you can do where like that small little shift and all it was a recommendation to try this,
Yes,
just like in your own life and now with him and I know so many others that you're now having
yes.
that impact. Okay, I want to ask one more question because, being a nurse, and obviously you're a great nurse because how you're taking care of your husband. That's the hardest patient in the world, right?
Yeah.
But, this company also has something really unique. So Alovéa is a social business,
Yes.
meaning for every single product, it's a buy one, give one model. So every single product,
Hmm.
you're consuming yourself, but there's also the same donation of that same technology that you first took that's being donated
Hmm.
to children around the world. you
Hmm.
know, as a nurse, like or just as I guess, a nurse slash human, how does that make you feel being part of a company that is making that difference and knowing that you're supporting and making a difference? How important was that when you made your decision to saying, I want to be an Alovéa Pro, I want to be sponsored by this company?
Actually, that was one of the most important things. There are so many children who are ill in the world. Just Sam's story, he and Linda, trying to have children and going to Romania to go get these kids. And the doctor's like, "Oh, no, you don't want these kids. They're dying, you know? And they waited a year. But in the meantime, Sam supplied this Mighty Melt and then, Ace Man in a sprinkle form and just let the kids have it. And instead of however many kids were dying every year, they had no deaths, no deaths. To me, that is over the top. And so I just, that's very big for me and it actually made me feel like I was part of something bigger than big. Sorry, I'm crying, but
No,
the
I love
children.
well, I mean, it shares your heart and it shares who you are. And as probably so many nurses out there and healthcare professionals, they want to have a bigger impact, but they're almost so bombarded with
Yeah,
everybody that's just showing up in the hospital or in their
yeah,
like you can't do that much more. You're only servicing the people around you. Now you're building
right,
something that you're sharing it with others and you're creating
right.
a ripple and knowing that
Yes,
not only what you're consuming for your own health, but as you're sharing this with other people and even
yeah,
sharing this podcast to share this with other
yeah,
people,
yeah,
now all of a sudden other people can get healthier. But as we get healthier, it's changing these children's lives. That's meaningful.
absolutely. I check my Ripple all the time because I just love that part of it, that I can check it. And then, of course, seeing, what my team does, I see that. And just, it's a beautiful, beautiful impact. And I
Well,
love it.
and I think that's so cool. Like there's not many companies will donate, but when you do top line revenue giving where everything you sell, you're matching it, but then you're tracking it. So we
Hmm.
all see it's total transparency. You see exactly how much,
Yes,
like you said, that's that ripple that you're tracking, which is powerful. Well, Kori,
yes.
this has been such a pleasure spending time with you. You have a heart, an absolute beautiful heart committed to your faith and committed to
Thank you.
nourishing children and helping all of your patients, including your husband,
Oh,
which is
yes.
a very good thing. Well, we appreciate you being an Alovéa Pro, and we look forward to seeing everybody else on our next Alovéa Pros podcast. So thank you very much today, Kori.
Thank you.